Okay, so for test taking strategies, the first thing that you need to figure out when you're reading a question is, what are they asking me, right? So you want to figure out what's the topic. And sometimes there's a lot of information in a question, and you're like, well, gosh, I don't know. So if we're talking about heart failure, they could have digoxin, they could have Lasix, they could have some signs and symptoms, and you're kind of like, well, what's the question about? So you want to see, can I figure out what it's about? If not, maybe let me look at the clues. Is it about a medication? Is it about the signs and symptoms? Okay, so that's your first part of the battle, is what is this question about? Okay, once you figure out what the question's about, then you want to move on to nursing process. So remember nursing process, you guys all learned ADPI. So we're only going to focus on the assessment part and the intervention part. Because when you're asked to make a decision, you're either going to have to assess something, gather data so you can make a decision, or you're going to just do something, right, to help the patient. And they've given you all of your assessment data in the question. So you're going to go through each answer choice and say, is this an assessment or is this an intervention? So you've got your heart failure patient, and maybe one of the choices is assess the pulse ox. And one of your answer choices is assess the IV site. And it might not say assess, it might say obtain or, monitor or something like that. And then you have a couple of implementations. So you have administer the furosemide, or set the patient up high Fowlers. Okay? So you've got your choices, you look at your assessments, you look at your interventions, and you say, well, which part is first in the nursing process? Assessment, right? So I need to see, do I need to do those assessments before I can do something for this patient? Because I need to help the patient right now. So I need to pick something either that's going to help them right now, or the assessment that's going to give me the information I need so I can help them right now. Okay? So you look at the assessments, and what did I say? Pulse ox and IV site. Okay. So you ask yourself, do I need to assess the pulse ox? Will that change what I do for the patient? Well, let's say that in the question, it told you as part of the symptoms, the patient was short of breath, but they had a pulse ox of 92%. So I don't need to assess that pulse ox anymore. And the way that we're going to change your thinking is we're no longer looking for the right answer. Okay? We're trying to eliminate answers. And then once we eliminate our answers, which mostly is going to be down to 2, then we're going to ask ourselves which thing is the safest choice, which one makes more sense to the question. Okay? So we can get rid of the pulse ox one. So now we only have 3 choices that we have to look at. Do we need to assess the IV site? Well, it said in the question that the patient was on furosemide PO regular, but we know that we might have to give it IV, right, for an emergency. So let's hold on to that one. Okay, so that's the assessment, the nursing process step. After that, you're going to move on to the Maslow physical versus psychosocial needs. And I know there's a whole bunch of needs. All we're going to do is look at, are the 3 choices I have left, are they physical or are they psychosocial? Because which one do you think is going to be more important? Physical. Because if your patient can't breathe, it doesn't matter how they feel, right? So you're looking at, are the choices physical or psychosocial? And you're really just looking, is there anything psychosocial? Because I'm going to get rid of it. If it said, stay with the patient, and because they're anxious or whatever, you'd get rid of that one because there's physical needs that are going to be more important at that moment. Okay, so we've got the IV site, we've got give the Lasix, and we've got high Fowlers. So those are all like physical things. So we can't get rid of anything in that step. So then we move to ABCs, which is usually where we think we're supposed to start, right? but we've done nursing process, and then we've done Maslow because we know he's got the basic needs, right, in the bag. So we're going to move to ABC. So we're going to look at each choice and say, is it an airway? Which is more like an open airway or obstruction type thing. Is it breathing? So breathing pattern, weakness of the chest wall, whatever. Is it a breathing thing or is it a circulation thing? Okay, so we look at, check the IV site. So that could be circulation, okay? We look at of course I just made this question up on the fly, so I keep forgetting what it was. And then the Lasix, right? Giving the Lasix would be circulation and breathing maybe, right? Because it's going to help get rid of the fluid. And then the third choice, the high Fowlers, would be an airway breathing. Sometimes the airway breathing is hard to distinguish between the two. Okay, so you would want to keep the airway breathing over the circulation, right? So you would keep your Lasix, you get rid of your IV one. You'd keep your Lasix and you would keep your high Fowlers. The most important step is at the end. So I'm down to 2, right? Which most of us can get down to 2, even without strategy. You're like, dang it, which one? Okay, so this is the step where you look at what is the safest thing that I'm going to do for my patient. Okay, that's one thing. The NCLEX is a safety test. 2, if I can only do one thing and leave the room, what is it going to be? Okay, and that's a really good tiebreaker. And 3, does it relate to my topic? Because what happens very occasionally is you've got, especially when you're learning how to do this kind of thing, you're looking at your question and you've somehow gone down the rabbit hole and you're wanting to pick something that maybe isn't related to your question as much as you thought, right? So let's say that the last part of our question was, what are you going to do first? So now you're left with 2 answers and you got to prioritize. Which thing am I doing first? The question didn't, so then you have to ask yourself, okay, so I can either give Lasix or I can put the patient high Fowlers. Do I have enough information to do something, or do I need to gather more? Do I have enough information to give the Lasix? There's no potassium level in the question. I cannot safely give Lasix. And everything that is a choice is ordered, okay? But I can put the patient in high Fowlers, right? So that's the choice you're going to pick. How many of you would have picked Lasix? Okay, so sometimes the answer is put the head of the bed up. You don't want to assess something twice. If the question says the patient is in semi-Fowlers or the lungs sound like this, don't assess them again. You've already assessed them. Okay, so that's kind of the basic thing, the way you want to attempt or attack any kind of question. Okay, the other nice thing is when you have a method, you forget to be emotional about it because you're so focused on doing the steps, right? So like when you're learning skills and fundamentals, and yeah, I'm terrified to put that Foley in front of the teacher, but if I'm thinking, okay, number 1, I'm taking it out of the bag. Number 2, you forget a little bit about being anxious at that moment. And then you're all done and you're like, oh my God, I'm shaking. Well, yeah, because now you have all that adrenaline going and you've remembered that, oh my God, what did I just do? I just checked off, or whatever it is. So if you have a method of some sort and you do it every time to the questions, it will assist you in that way as well. Okay, so that's the basic strategy.